A town in southern Oklahoma has been ripped apart by a powerful tornado. Most of the injured have been brought to Southwest Medical Center, and its most shocking casualty, 32-year-old Julie Rakestraw.
You're at the hospital. We're the doctors and nurses. We're going to take care of you.
Doctors J. Christopher Carey and Martin Lopez are struggling to help her breathe, but are forced to work in the dim light supplied by emergency generators.
Bro, look out!
Her sets are 80 and falling, Doc.
What's that mean?
Sir, if you could please wait outside, we need all the room we can get here. We'll come and find you as soon as we can.
Please, understand that we're control her airway.
Come take it easy. I'm gonna hold pressure for you.
Come on. Get ready for bleeding. Get ready for bleeding, guys. What's the status on that crash cart? Someone help us. Come on.
Coming through. I found a crash car.
Emma, thanks. Hurry. Let's prepare to intubate, guys. Give me up top, please. Up top. It became readily apparent and obvious that we were going to have to take interventional measures to try to protect her airway, the simplest of which would be insertion of a breathing tube. As I was attempting to look into her mouth with a laryngoscope, nothing looks like it should.
Chris, I can't see anything that's recognizable. It's a bloody mess.
The pressure of the wooden picket going through her neck has displaced all the anatomic structures. That creates a problem for us. This may hurt a little bit, I'm sorry. We got to keep your airway open.
I'll bag.
Right, take this for me. We go into plan B to try to support her, put an oral airway, which is a plastic device just to keep her tongue from going back in her throat, try to use a bag mask system to try to force some air into her. That's met with great difficulty. At this point in time, we have no choice. The picket has to come out.
Can't trach her, can't intubate her. The board, we have to take it out right here.
Here, we need an OR for that. She'll bleed out.
We didn't have time to wait for the other devices and had to move forward with extraction of the device and attempt to save this lady's life.
We don't have the choice. If we do not do it, she's gonna suffocate.
We knew by doing it we were gonna face the risk of increased bleeding and hemorrhage, but if we don't control the airway, all those other things don't matter anyway.
Don't take your eyes off those monitors.
I won't, Doc.
Bladder shields.
See, we're gonna need a surgical tray, we're gonna need suction, and we're gonna need a pile of sponges.
Suction's ready and up. Got the sponges.
We're both surprised with how much force, how much resistance we're encountering in pulling this out. And ultimately, as this patient is continuing to spiral downward as far as her oxygen saturations and her other vital signs,
75% still.
not coming. We literally have to grasp her by the head with one hand, the shoulders with the other. We're gonna steady your head. All right, give it all you got, buddy.
That's
Come on,
74%.
give it a try. Is it coming? Is it budging? No? We're gonna have to try something else. Jake, come over here, give us a hand.
You're doing good.
Let's get some counter traction. Give him something to pull against.
74% dropping.
This might hurt a little bit. Bear with us, sweetheart. And Dr. Carey, with two hands, with quite a bit of effort required, pulls. Yeah, it's coming, it's coming. As this is withdrawn, it makes the suction noise like when you're pulling your foot after it's been stuck in a mud hole.
You always anticipate the worst. We're taught that way.
Coming, coming. Oh, yeah, oh, my. All right, come on, pressure on this wound. Pressure on this wound, hurry. Sponges.
Doctors J. Christopher Carey and Martin Lopez have just removed a large fence picket from Julie Rakestraw's neck.
All right, bag her.
It was the only option to save her life, but it may just kill her instead.
Dr. Carey and I are not surprised with the fact that the hemorrhage, the bleeding, picks up briskly. The free ends of the vessels which have been cut, they're now exposed.
I need to find a source. I need magnification.
It's all right.
We're gonna lose her like this.
Quick look, here we go. Fortunately, once the plank was out, all right, I can see the larynx. We were able to get the breathing tube in without any difficulty at all. Hold that tube steady. I want a hand on that tube, please.
I got it.
Okay?
Yep. O2's coming up.
Okay.
And there's no way I can stop the bleeding. And that's a very frustrating and difficult position to be in. And you don't want to be there.
Get ready to move her. We got to go. We got to go.
We worry about having her bleeding to death. So the decision was made to take her immediately to the operating room where we could have better control over things.
Clear this hallway. Let's go. Go. Chris, I'm going to change scrubs. Go see the husband. Don't sugarcoat. I won't.
We didn't have the luxury of doing a workup, CAT scans, x-rays. We knew what we had to do to get the bleeding control that she had in her neck.
Excuse me, looking for the family. Julie Rakestraw.
Yes.
Miss Rakestraw.
Is she okay? Is she okay?
Miss Rakestraw, your wife's in very critical condition. Right now, she's in the operating room with our surgeons. We're doing everything we can.
You just have to be patient. We'll be back. I'll let you know. I or someone else will be communicating with you as frequently as you can. Okay? Just have a seat. We'll be back with you. Okay.
Thank you, doctor.
What we needed to do was to, first of all, get control of bleeding.
Jab and shunt.
Most of that blood was from her jugular vein.
It's like she's bleeding right here, behind the temporomandibular joint.
You're right, but I can't get back there.
Because it went in the base of her ear and made it extremely difficult to get to this area, and we had to break her jaw to get control of the blood vessels above that area.
Some suction in there.
The 2x4 had gone right through the middle of the neck, almost like an arrow and a target.
We gotta get that clot out of there right now.
Suction.
It caused damage both to her internal carotid and external carotid arteries. She also had developed clot in her internal carotid artery.
This is a devastating discovery. The carotid artery supplies blood to the brain, which means the flow of oxygen to Julie's brain has been blocked.
I'm really worried about the right side of her brain, Chris.
The longer she's without blood flow to her brain, the more likely it is to be permanent damage. Overall term in the back of my mind was, we have a brain dead patient here we're operating on. My fear was that I'm doing all this work for really nothing. I mean, you should have significant brain damage, but we had to get the best shot we could. And there's nothing we could do about it at that time other than try to restore blood flow to her head and to see what the end result is.
The images we're seeing are unlike anything we've ever witnessed. The path of destruction cut by the massive Category
The power has been restored, but it's been a rough night for Dr. Carey and the entire trauma team of Southwest Medical Trauma Center.
Dr. Carey?
Hey, Stevie.
You haven't slept yet, have you?
No.
I was here till 4 or 5 o'clock in the morning taking care of these patients, trying to make sure that everything's all right with them.
I haven't slept either. I kept having nightmares all night about that woman with the board in her neck.
In the wake of the catastrophic tornado, 32-year-old Julie Rakestraw clings to life.
We did all this work not knowing if she'd survive, not knowing if she'd be a vegetable from all the injuries she had, and it was kind of a scary deal going on.
I was just gonna go check on her.
Do me a favor, keep me posted, okay?
Okay.
Julie's neighbor, Jason Starks, has also had a sleepless night.
I expected to go to the hospital hoping that she made it, but I didn't have my hopes up.
Looking for Julie Rakestraw?
How do you spell her last name?
R-A-K-E.
They were able to tell me that Julie was in ICU.
Make a left and take the elevators up to the 7th floor.
Thanks.
I was surprised that Julie was alive.
Dr. Martin Lopez has also come to check on Julie. She's still unconscious, but stable.
Hi.
Hey, Chris.
Doctor, hi. How's our patient here? How's she
Well,
doing?
we've just been watching. Vital signs are stable. Still waiting neurologically to see if she's going to come around. Julie?
Julie? Hey, baby. Hey.
She may not recognize you. I don't want you to be alarmed.
It's okay. Just talk to her.
We looked for signs of stroke, unable to move one side or the other.
You wiggle your toes for me?
She was able to start moving her legs and arms, so we knew basically her motor function was intact. So that was a blessing too.
Jason, come on in. Doctors, this is Jason Starks. He's our neighbor.
Hey, how are you? Good to see you.
He saved her. He saved her life.
Look, Julie, you want to write? Here.
Julie can't speak because of her breathing tube, but she has plenty to say.
You don't need to thank me. Just glad you made it.
She believes that I saved her life, but I was just a part of the many things that had to go right for her to live.
To me, it's amazing that her power and willingness to overcome this are just remarkable.
You don't have to thank us either. We're glad you're here.
Quite welcome.
It's unbelievable to me that someone with this magnitude of injury is with us still today.